Okay, I'm going to talk to you about Lipodissolve, something we used to refer to a similar form of as mesotherapy. So mesotherapy is really the historic name that was used to describe injections into the fat to dissolve fat. And the term mesotherapy was used because we were injecting what's called the mesoderm, which is a portion right below the skin. And the French had been using injections of tiny dose of medications for various conditions such as lymphedema or swelling, pain. And in the 80s, late 80s, early 90s, it was discovered that using a compound called phosphatidylcholine deoxycholate, and I'm bringing my little whiteboard up here so you can see this, phosphatidylcholine deoxycholate, PCDC, we'll refer to it, did reduce fat. There was a study done in 1996, I believe, by Dr. Ritz, R-I-T-T-E-S, in Brazil, where she presented that using phosphatidylcholine deoxycholate, or PCDC, in the bags that occur in people's eyes could reduce the size of the bags. And it didn't really hit the United States until about 2004, when some doctors, started, including myself, started doing injections of phosphatidylcholine and deoxycholate under the skin to reduce fat. But we were influenced by the French, who had been using other things for cellulite, such drugs such as aminophylline and yohimbine and isoproterenol. So we met at several meetings. We decided we're going to mix the two, both the European French mesotherapy along with the Brazilian phosphatidylcholine deoxycholate. And again, it was sourced in different places, but those were really the big influencers, was Brazil and Europe. And there was two different sort of pathways that people went down. One was the mesotherapy. Another one was a term that was coined Lipodissolve, which was just using pure deoxycholate with phosphatidylcholine. And then people with mesotherapy were doing that plus the additional medications. And we went down the mesotherapy route, where people in the Lipodissolve mindset were actually using higher doses of the phosphatidylcholine deoxycholate, maybe getting a little bit better results. And we recently, we actually wound up dropping the other components, the other drugs that limited the amount of medication you can use. And in the early 2000s as well, when people were going, doctors like myself, cosmetic doctor, were going to these meetings that were looking at what medications are causing the effect. The assumption was, well, they all are. They're all doing something. We use multiple different things that seem to cause what's called lipolysis or reduction of fat. But there was a Dr. Rotunda, I believe he was a resident at UCLA at the time, and he started testing the different components of the mesotherapy or Lipodissolve. And there was, again, two key components, phosphatidylcholine and deoxycholate. And they're two separate compounds that are put together. And deoxycholate is a bile salt, and phosphatidylcholine is a different component that emulsifies things. So he started experimenting on pig fat, and he found that the deoxycholate appeared to be more responsible for destroying fat cells than phosphatidylcholine. But when you injected deoxycholate by itself, it caused a tremendous amount of nodules and pain and discomfort, even though it worked just as well as the combination one. He was trying to find a drug, a single drug, not a combined drug, that he could patent and go to the FDA, get approval, and have a commercially available drug. It's easier to have one drug than a multiple drug. And plus, the phosphatidylcholine deoxycholate was already out there. Doctors were getting compounded from compounding pharmacists. So it took about 10 years, but eventually he made the product. It was eventually called Kybella. When Allergan bought it, Allergan makes the Botox and fillers, and they bought it for a couple $2 billion. And they found that if they took the deoxycholate out of the PCDC and gave tiny little droplets just in the fat under the chin, tiny amounts, people could tolerate the side effects. They really never got it approved for the body because it would take too much, and without the phosphatidylcholine in it, it's just too painful, too much nodules. In fact, studies were done looking at phosphatidylcholine plus deoxycholate, PCDC, versus deoxycholate alone on people in different fat pockets of their body. And they found they both work pretty much exactly the same. They both reduce fat substantially over a period of a few weeks. But the deoxycholate led to way more what's called subcutaneous nodules, where they get these kind of lumps under the skin, way more pain and discomfort, more downtime. Whereas the phosphatidylcholine deoxycholate group had much less the nodules and pain and discomfort and downtime. So we just continued using the generic version, which is produced at an FDA-approved lab. We have used Kybella, the FDA-approved drug, but it really has a lot of side effects, and it does not work any better than the generic stuff, and it costs a lot more. But that's kind of the history of how this came about. And also we're finding that by removing the other components, aminophylline, isoproterenol, all the other things that were used in the mesotherapy cocktails, we can use a higher dose of the PCDC and treat larger areas. Actually treat large areas with more concentrated medication and get done treatments much faster. When I was doing this years ago, we'd do like 4 to 8 treatments, but now we're doing 2 to 4 treatments, getting the same results. So pretty much kind of like Cool Sculpting is 2 treatments, 70% of people getting Lipodissolve, which is the phosphatidylcholine deoxycholate. They'll get 70% of people will be happy with 2 treatments, get up to 4 treatments, and about 98% of people respond. There's still people that don't respond, don't get a result. We're not sure why. Maybe it's because they're poor selection. They had a little bit too much thickness. Maybe there's something else reason that it didn't work. So that's what we're referring to as Lipodissolve. It's either the Kybella, the branded medication, or the PCDC, the generic form, which is compounded by a FDA-approved lab, but it's not FDA approved to be used for reduction of fat. So it's actually approved for both components are approved for different conditions. So it's not FDA approved, the PCDC, for reduction of fat. It's made by a FDA approved compounding manufacturer under sterile conditions. And then we use it, inject it into fat. We see people get red and swollen, pretty significantly red and swollen and sore for 2 to 4 days. The first day it's really significantly uncomfortable. Not necessarily we need to take pain pills, maybe Tylenol or Advil. And then the next day is 50% better, next day is 50% better. Some people tolerate it well. Some people, they have more discomfort with it, so they wouldn't want to go to work the next day. So people can be the judge, how sensitive they are to discomfort. We can't really predict who's going to have more discomfort, who's going to have less, but it's nothing like surgery. The results are pretty similar to what I've seen with Cool Sculpting or these other devices that reduce fat. It's more cost effective. The cost is a lot lower. The medication is relatively inexpensive versus the machines that are very expensive to use. There's like a licensing fee to use machines even after you buy them. The Cool Sculpt has the advantage of being able to grab an area where there's a roll of fat. I think that's still the gold standard for rolls of fat, but where it's more flat or where it's really kind of a customized area that the Cool Sculpt heads don't fit on perfectly, that's really where the Lipodissolve comes in. So that's kind of the story behind the PCDC, which we're referring to as Lipodissolve. It's a term that's been out there since about 2005. It got really popular until about 2011 when these machines came out that could do the same thing. It didn't require the knowledge and the expertise that it required with having the PCDC, which took me a while to learn how to do it. And we had to get a lot of expertise. You got to get it made by a compounding pharmacist. So it's kind of becoming sort of hot and sexy again to do the PCDC because people are more and more interested in non-surgical fat reduction. And they're looking for options. And sometimes the machines don't quite fit the area of the body or might be too cost prohibitive for some people. So thank you for listening. And that is Lipodissolve.